Hey, welcome back. Today I'll be discussing few recalls from one of my student who cleared DHA exam last week. So these recalls are from August 5th. So I have written exactly what she gave me and I'll be discussing more about these topics because few of these topics are most repeatedly asked. So we can discuss. So these are some of the questions. So the first question was the main treatment of Kawasaki disease. So this question, they might have given few more things, like they could have given some of the features of Kawasaki disease. So I'll give you a brief idea how will be the presentation in Kawasaki disease. So basically Kawasaki disease means it is a vasculitis, and this vasculitis usually affects children below the 5 years. And the main features are the patient can have features like fever, and they'll be having some features, and also they'll be having some features like conjunctivitis, rash. Then also there will be some extremities changes, like they can have erythema over the palms and soles. And the main feature is this redness can later leads to desquamation also. And they can also have some mucous membrane changes like strawberry tongue, then fissuring of lips, and also the lips becomes red in color. And also one more feature is cervical lymphadenopathy. So basically they'll be having fever, and at least 4 of the following features will be there. Like as I said, the main 5 features like conjunctivitis, rash, extremities changes, mucous membrane changes, and cervical lymphadenopathy. Again, the treatment is we should treat the child as soon as possible, because one of the complications that leads or that is usually seen in Kawasaki is coronary aneurysm. So to prevent this, we usually give IV immunoglobulin in these patients. So in this question, there was asked which is the main treatment of Kawasaki disease, and the answer was IV immunoglobulin. Okay, and also this should be given within the first 10 days. Then only it will reduce the risk of coronary artery aneurysm. So that was the first question. Again, second question. A patient with history of fracture femur presented with dyspnea, shortness of breath, lethargy, and fever after 2 days. Okay, so they are asking after the post-operative day 2, the patient had all these symptoms, and also they are mentioning that this patient had a history of fracture femur. Okay, so here the diagnosis, they are asking what is the diagnosis. So the diagnosis was fat embolism. So what happens is whenever there is fracture in the low bones, the fat will be coming out as little vesicles, and this will cause some occlusion in the vasculature in our body. And the usual fracture that contributes to this fat embolism is fever. So the patient can have, as in this question they are telling, the patient will be having some symptoms like confusion, then rash, and also shortness of breath, very important, fever. Okay, so if a patient with history of fracture femur or long bone fracture is presenting with these symptoms, always suspect fat embolism. And we can do some of the investigations, like we can do ABG, chest x-ray, and in urine analysis also we'll get some fat droplets and all. Okay, so here the answer was fat embolism. Again, moving on to next question. So the next question is a patient with history of secondary amenorrhea for 8 months, first test to be done. Okay, so they are asking which is the test that could be done in this patient who is having secondary amenorrhea. So amenorrhea means it is absence of menstruation, but here it is secondary amenorrhea. Secondary amenorrhea means it is cessation of menstrual cycles following some established cycles. That means this lady was having cycles, regular cycles, and suddenly the menstruation was stopped. Okay, again we have another term that is known as primary amenorrhea. So primary amenorrhea means the child, it is usually like found out in early age. Okay, that means the child or the female haven't menstruated. Okay, that means it is lack of menstruation before the age of 16 years. Okay, and also in some individuals secondary features also will be absent. So they are asking, this patient was having this menstrual cycles in a regular way, but suddenly she is not having menses for the past 8 months. So what could be the first test to be done? Okay, so you need to know that there are lot of causes that can lead to secondary amenorrhea. So one is PCOS could be a reason, then hyperprolactinemia, okay, like because of some prolactinoma or pituitary tumors and all, they can have the secondary amenorrhea. Or or the other feature is, other important thing is pregnancy. Okay, so first of all we should do a pregnancy test in this patient. Okay, so that is the first test to be done. Okay, then since this patient is having the secondary amenorrhea for 8 months, we can rule out other causes also, of course, but it's always better to do pregnancy test or UPT initially. Okay, again, if UPT is negative, we can go, as I said, we can go for other tests to rule out other conditions, like as I said, PCOS, then hyperprolactinemia. There are a lot of causes, like the other causes like anorexia nervosa, eating disorders. All these can contribute. Okay, so here the answer was UPT or pregnancy test. Again, moving on to next question. A child came with vomiting and abdominal pain. Ultrasound showed donut sign. Okay, so this is a child with vomiting and abdominal pain. Again, the important clue they are giving is the ultrasound finding, that is donut sign. So the donut sign is actually seen in a condition that is known as intersusception. So intersusception means a part of bowel will be telescoping to its adjacent bowel. Okay, so usually the child will be having vomiting and it is a painful condition. Okay, so of course this child will be having severe colicky abdominal pain. That is very, very important. Okay, along with that the patient can have vomiting and it could be bilious vomiting. Okay, and on examination when we palpate the abdomen, we will get a sausage shaped mass. That is very important. Okay, and also another important thing that they can add in intersusception is a peculiar type of stool that is known as red currant jelly stool. Okay, so all these features are seen in intersusception. Okay, so remember vomiting that could be bilious, then abdominal pain, the patient will be having, the child will be crying. Okay, so that the crying is because of severe, the pain is very severe. Okay, so the child can get severe colicky pain and also red currant jelly stool. So all these are signs which we see in intersusception. Okay, and when we take ultrasound, here they have given the most important sign that is known as donut sign. Okay, or they can tell like the donut sign, or there is one more sign that is known as target sign. Both are correct. Okay, so they are asking what is the treatment. Okay, so in this case immediate enema reduction is the thing we can do. Okay, so it could be air enema or barium enema. Okay, so always choose, like when we compare, air enema are more preferred. Okay, because it is faster, okay, and safer also than the contrasting. Okay, so here the answer is air enema. Okay, that is about this question. Again, next one is celiac disease histopathological findings. Okay, so they can give you some features of celiac disease. Okay, so celiac disease means it is usually because of gluten hypersensitivity. That means when the patient takes food that contains gluten like wheat, barley and all, they can get this celiac disease. Okay, or it will be precipitated when the patient is taking these type of food. Okay, so what happens is the patient will be having some malabsorption. Okay, so this is a malabsorption syndrome. So there will be malabsorption of fat. So the patient can get steatorrhea, sticky stools, diarrhea, and usually we know that it is the small intestine that absorbs all the iron, then vitamin B12, folic acid, everything is controlled by the small intestine. So what happens is, since this is a malabsorption syndrome, all these like iron deficiency, folate deficiency, vitamin B12 deficiency, all these anemias can occur. Okay, that is also one among the important findings. But here they are asking which are the histopathological findings. Okay, so what we do is we will be doing the biopsy. Okay, we can do the jejunal or duodenal biopsy. So what we get is all the villi will be atrophied, will be shortened, and also we can see in the crypts it will be hyperplasic, and there will be some increase in intraepithelial lymphocytes also. So these are the three findings that we usually get. Here the answer was villus atrophy. So they actually gave some of the features that is seen in histopathology, and they asked to like find which is the appropriate answer. Okay, so remember the main findings that we get in the biopsy is villus atrophy, crypt hyperplasia, and also there will be increase in intraepithelial lymphocytes. So that was this question. Again, moving on to next one. So next is which is the most common organism that causes acute bronchiolitis. Okay, so acute bronchiolitis means usually it is an acute infection of the lower respiratory tract, and this is seen in very young children. Okay, mainly under the age of 2 years. Okay, so they are asking which is the main organism. So the organism is respiratory syncytial virus. Okay, in around 70 to 80% cases, the children with bronchiolitis will be the main causative organism will be RSV virus or respiratory syncytial virus. Okay, again in this question they can again this question was direct, but they could ask some features also. Okay, so in bronchiolitis they can have features like cough, breathing difficulty, fever. Okay, but all these features will be in a very young child, that is mainly less than 2-year child. Okay, so that is about this question. Again, next is septic arthritis, single investigation to do. Okay, so they will be giving you a lot of options like the blood count, blood culture, okay, aspiration. Okay, there will be many options, but when we find some features of septic arthritis and when they ask you to just choose one single investigation, then the answer is to aspirate the synovial fluid. Okay, because septic arthritis means this is caused because of some organism. Okay, so we need to see this organism because there are a lot of organisms. Okay, so one is most commonest one is Staphylococcus aureus, but in young people it is because of Neisseria gonorrhea. Okay, so different organisms can actually contribute to this septic arthritis. Okay, so it is always better to aspirate the synovial fluid. Okay, and we will be sending this fluid for gram staining, leukocyte count, culture and all. Okay, so here the answer is aspiration of synovial fluid. So that's all for today. So I will be covering more recalls in other videos. And also I am conducting online classes. So if you are interested, please contact me in my email ID. So thank you.